Welcome to Adapting Class. IV insertion techniques. This is fundamentals, concept that as a nurse, you should be more comfortable. When you see it in the question, you should be comfortable answering it. So let's get to it because this is something that keep on showing up on the NCLEX. So there's certain key things you're supposed to know. So first thing, I will give you the steps and then you will figure out what is the content that you need to know, but I'll point out to you for every steps, right? The first thing is you know that there's steps. There's a couple of steps depending on which video you watch or book you use. This or trying to simplify it. So every step, the first thing you do, first you got to verify the order. Or as usual, does this patient need an IV? And then is it indicated? And then you gather your equipment that you need to know. That is the most important. They can ask you which of this is indicated. So if, of course, you need an IV catheter, and the selection is based on the individual size. So pay attention to that. Whether the old kid, older patient in the situation form, you need a tourniquet. This is very important. It will come in handy, right? And then you need to have antiseptic. It's a sterile technique, so you got to make sure um, you clean the area, especially a swab, to help with that. You will need a IV tubing. Sometimes you got to prime them to be ready. And some fluid, what you need to give it to the patient, either it's a medication or anything like that. You need some saline flush after the procedure to keep the IV open. And then you need a tape, but most of the time we use a transparent dressing, adhesive, to help with that. And then you tape using a gauze. These are the equipment that you need. The next thing you do first, you gather your equipment and you identify the patient is you got to perform an hygiene. As I said, and then you explain the procedure to the patient, what they should expect. Most of the time, it should not be, uh, it's not that painful. You will explain to them that there may be some pressure, there may be slight pain, right? And then you identify them. You need two identifiers to be able to say, hey, this is you are the right patient. Okay. And the third thing is basically, as I've explained it, you may have to apply a tourniquet, right? Most of the time, that's what people use. This is to distend the vein. Where do you apply it? This is the question I was asked, and this is what it shows up in the NCLEX. Um, you need to apply 4 to 6 inches, okay, above the site of insertion. This is very important. The distance from the technical application, that's the specific question and what you do with it. What is he doing is going to distend the vein and allow you to see it. Key concept they may ask you, don't leave it on for more than 1 minute. That's number one. Don't leave it on for more than 1 minute. If you are unsuccessful, so this is very important. Unsuccessful unsuccessful. If you are like unsuccessful, then you should be careful. Don't leave the tourniquet on. Um, you should release it. Release the tourniquet. Wait another 2 minutes before applying again. Very important. Unsuccessful, release it. Wait for 2 minutes before applying it. And those are the keys associated with tourniquet. Application 4 to 6 inches above the site of IVI site. The number four thing you need to do is select the vein. Vein selection is the key. Your patient will love you. Best place, your forearm, okay, or the hand, okay. Avoid joint. Joint is bad, okay, or dominant. Patient dominant hand, avoid because they'll be moving too much with it. And the vein that you can select, if you can see it, is cephalic, basilic, and the media cubital vein. What does that mean? You may see a question like that, they want you to identify them. If this is your arm, or right, and this is your forearm, the vein on top, if your hand is like that, the vein on top, this is the cephalic vein. The vein at the bottom is the basilic. You see base and cephalic top, head. And the one in the middle is the medial cubital vein. So cephalic is the top, basilic is the bottom one, and the medial cubital is the one in the middle. So those are the structure of the vein. Like I said, the things you should avoid are the near joint. Okay, avoid those that are near joint as much as possible. If it looks sclerotic, don't use it. Like, don't use it. If you look bruised, don't use it. And don't put it near previous IV site, not near previous IV site. Don't select that. Okay. The next one is the cleaning the site. You have to clean the site. So you clean the site for your IV, and you usually use antiseptic wipes. Sometimes you can use chlorhexidine or alcohol. Chlorhexidine or alcohol is fine. And then you insert the bevel up. Insert bevel up. This is very key. All the things I'm going to say right now is very important. Insert it after you clean, insert bevel up. Then you advance until you get a flush. This is what he can ask you. You advance until you get it flushed. As soon as you see the flush, lower the angle and advance the catheter. Don't pull it out. You advance the catheter into the vein. This is key. This is how that you know how to do it. Then you withdraw the needle, leaving the catheter in place. This is key. So when you see it flush, advance it, push the catheter over the needle, pull the needle out, and leave it in place. Then number 7 thing you do is basically release the tourniquet. Release the tourniquet before you flush the IVs, right? Otherwise, you're going to damage it. Then number 8 is secure it, IV in place. You can use a dressing, then you use a transparent gauze that we talk about, and then you date, location, and time. That's all. Those are the keys. They may ask you IV gauge that you're supposed to know in terms of which situation do you use it. So I'll give it to you. There's 14 gauge and 16 gauge. This is very good in trauma patient. In trauma patient, very, very good. Or you need a rapid infusion or emergency, right? This is very good. Sometimes you can use it for surgery, but it's not the best one. 18 gauge, right, is for blood transfusion. It's very, very good. You can also use it for surgery also. 20 gauge is good for general, everybody. Older patient, no older patient, general patient population. This is very good for that. 22 gauge is mostly for elderly patient, or you need a slow infusion. And then 24 is mostly slow infusion. Sometimes you can put pits here. And 24 is basically young, fragile. If you have a fragile vein, yeah. And then if you're a newborn or neonate, this is what we use. And this is quick IV insertion technique. Watch for the tourniquet location size. Watch for what do you do when you see a flash, what do you need, and some of the gauge that you need, and some of the equipment that you need for the procedure. So this is the quick lecture. As usual, it's a bite-sized information. I have a quick question for you. A nurse is inserting an IV in a client. After inserting the needle, they see a flash of blood. What is the next step? Immediately withdraw the needle, advance the catheter while withdrawing the needle, flush the IV to confirm placement, reapply the tourniquet. When you see a flush, that means you're in the vein. You want to advance and get into the vein more. You're probably sitting at the tip of the vein. Advance the needle and push the catheter over it. So you should not flush the IV because you are not inside yet. If you withdraw the needle, you lose the access to the needle. You reapply the tourniquet, there will be no blood for you anymore into your vessel. Therefore, advance the catheter while withdrawing the needle. This is the end of it. Take care of yourself. And this is the way to ask you questions regarding IV insertion. Take care and have a good day. Bye.